This is Conway Medical Center's Bringing Better Health to Life. My guest is Dr. Deidre Williams. She is with Waccamaw Pediatric Dental Care, and of course, she's a dentist. And I'm curious to find out where you were before coming to Conway.
Well, before I arrived here in Conway, I was actually in Augusta, Georgia. I was on faculty at the Medical College of Georgia, where I was the director of pediatric dentistry for the residency program. My husband is from Conway, and so that's how I got here. But I've been here for 15 years now. We opened our practice in 1998. Myself, as you said, I'm the only pediatric dentist there, and I have a staff of 7, 2 full-time hygienists, business staff, as well as the clinical office staff. So we've been very pleased, very blessed, and happy to be here in the Conway area. I
understand you run the whole gamut from birth to high school for a young person.
Yes, we actually do. The American Academy of Pediatric Dentistry recommends that the first dental visit should be at the age of 12 months.
Wow.
Yes, or 6 months after the first tooth comes in.
That's amazing, much earlier than I would have suspected.
Exactly. Most people typically think by the time the child is 3, it's time to go to the dentist, but no, earlier than that, because so many things can happen prior to the age of 3, as well as information that we can provide for prevention. As an example, new moms have their babies, hold them, when they're starting to cry and they're feeding them, whether they're nursing, breastfeeding, or whether they're doing with a bottle, rocking them to sleep, put the baby down. Well, the last thing you want to do is to put a baby to sleep with a bottle, because the sugar and the acid that could be in the bottle can affect the teeth and cause decay.
That's amazing. Mothers for generations have been doing just that.
They have, and especially breastfeeding. Oftentimes moms think because they're breastfeeding that they don't have to worry about their children developing any type of dental decay. So we always suggest, if you do that, please take a washcloth, just wipe the teeth off. Wipe the gum areas off, just so you're removing that initial bacteria, because when you're sleeping, your mouth is closed, you're having the least amount of activity, as opposed to, as adults, all day long we're talking, swallowing, so you're steadily rinsing. But when you go to sleep, whatever you eat or drink, the last thing you do at bedtime, that can set you up for creating decay. So early on you see decay in the primary dentition, so we try to talk to parents about preventing that as well.
I guess too, just having a baby come into the dentist amidst all those bright lights, the whole atmosphere, seeing a dentist, a strange face they haven't seen before, I guess all of that acclimates them to possibly, if you could even enjoy the dentist as you get older, it certainly helps acclimate a child to liking the dentist.
Of course, and oftentimes parents say, I don't know how you're going to do it, they're going to cry. Well, that's okay. But what we do is we create an examination area, what we call the knee-to-knee examination, where the mom is actually holding the child, and then the mom lays their child in our lap. And so the child still is looking at the parent, recognizing that the parent is not far away, and we're completing our examination, as well as showing mom or dad what to look for as they develop and grow and get more teeth in. So it's a joint effort all the way around. And we try to make it fun with music. We have lots of different television programs that are ongoing, different types of toys that create distractions for patients. So we try to incorporate a lot just to make it a pleasant experience.
I heard that the office is very bright and cheerful as well, Dr. Williams, because kids like bright colors.
They do. They do. They look forward to seeing it. We have a zebra that's blue and green.
And they love the zebra.
They love colors. Children love colors.
Well, and which is obviously another reason why you're wearing royal blue rather than the traditional dentistry white.
Yes, yeah, we don't have any uniforms with white.
I know you love that. We're going to take a break, but when we come back, we're going to talk a lot more about pediatric dentistry, and if you want that advice, don't go away.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
Our guest is Dr. Deidre Williams with Waccamaw Pediatric Dental Care, and we're talking about dental care for children. And I was shocked to find out that a baby should come in and see you about 1 year old or 6 months old, you said.
6 months after the first tooth comes in.
What about the bad habits that children, as they grow older, develop that forces them into seeing a dentist?
Well, some of the habits would be thumb sucking or digit sucking, so to speak, that oftentimes parents will bring them in because you know, when they notice that the teeth don't overlap or they see a nice space between the teeth, then they're concerned. So thumb sucking, pacifier, you know, these are habits that parents bring kids in when they start to see changes in the arches. And so they want to get some ideas in terms of how to break that habit. Well, for a 2-year-old, that may do a pacifier, the habits are hard to break. However, as they get older, we talk to parents about finding ways to distract them such that they can alleviate that habit. But if in fact that there are some damage that may be done to the dentition, then you know orthodontic intervention comes into play as well. Other habits that we typically see, nail biting. You'd be interested to see that, or children who oftentimes will lick their lips and just lick the areas very, very dry. So we just come up with some ideas to just talk to parents about how to prevent that.
Let's talk about other prevention issues for parents with little children.
Well, one of the things that we always recommend is as the child reaches school age and they start to get their permanent molars, prevention activities that we definitely want to see them do is we recommend sealants. Sealants are a preventive procedure that typically is just painted over those permanent molars to keep them from getting cavities. Those first molars will be in the mouth the longest. So that's definitely one of the things that we always often recommend. And then we just talk about routine brushing and flossing habits and the regimen typically that we like to do in that regard. Around age 7, first orthodontic consultation is recommended. You know, nowadays kids are ready to go to the orthodontist at a very, very early age, but typically around the age of 7 we do that as well, make that recommendation.
Years ago, the fluoride in the water in our community was a really big issue. Is
Yes.
that as pertinent today?
Fluorosis is still prevalent. It is still prevalent. And oftentimes, you know, when you see the brown spots, you know, we'll have parents in and we'll do a water sample to test the fluoride levels. And if those levels are high, we'll make recommendations in terms of whether or not they need to not do well water and maybe do bottled water. But we will test the water prior to making that recommendation.
Mm-hmm. Let's talk about your involvement with the hospital. Very unique, and I know you love your involvement here, and I believe you're even on the board.
I am, yes I am. I've been a board member 3 years now, but my initial involvement with the hospital was back in 2000 when I approached Mr. Clayton and talked about establishing pediatric dentistry here at Conway Medical Center. He was receptive, and we actually come to the hospital and do full mouth dental rehabilitation on those patients who may have medical conditions that their primary health care provider does not deem necessary to be done in an outpatient basis. or patients that have extensive dental needs. Oftentimes, children in this area who had extensive dental needs or medical conditions had to travel to MUSC for care. But Mr. Clayton was receptive to create that service here, and myself, along with Dr. Winona Newman, who's another pediatric dentist that has privileges here at the hospital as well, we provide the care here.
Fascinating. Dr. Williams, we just thank you for taking the time to be with us and educating us a little further on pediatric dental care here at Conway Medical Center.
Thank you.
Thank you so much for being with us. This is Bringing Better Health to Life, brought to you by Conway Medical Center.